I think hope is a very important thing. I think hope is what allows people to be resilient in the face of a very challenging situation, helps people engage in their care and ask the questions that they need to ask, and get through the symptoms that they might be experiencing, right? But there was this concept that I was exposed to very early in my work at Memorial Sloan Kettering. There was this person, her name is Jimmy Holland. She's sort of like the grandmother of psycho-oncology.
Okay.
She used to talk about this concept of like the tyranny of positivity.
That was perfect. You read my mind as to what I was going to ask you about next.
Right?
Yeah.
Like hope is not the same thing as like the tyranny of positivity. Hope is not the same thing as like, you have to think positive,
Gotcha.
right? Like, you're gonna beat this.
Okay.
Like, don't think negative,
Yeah,
right?
yeah.
These are very separate concepts. I think hope can be realistic. Hope is not being blind to the situation. Hope is understanding and having and being willing to think about the future anyway, right? I think a lot of patients with cancer, or many patients with chronic illness in general, there is a pressure to just be okay.
Yeah.
Right? To be a fighter. You want to be the survivor.
Yeah.
Right? But sometimes it's just really hard to have cancer. It's really hard to feel bad, physically and emotionally. That can be okay. Two things can be true at once.
Yeah.
You can have a day where you are just struggling and you're still hopeful.